Good day everyone! Today guys, we're gonna discuss about the discharge process here in the US. We'll tackle about the steps, the procedures, important things to note, and the differences between the discharge process from the Philippines, Singapore, and the US. So stay tuned and watch the video. I'm Juan OFW, your OFW. Once the doctor has decided that the patient is fit for discharge, the first thing he has to do is to key in everything on the system. He'll key in the discharge order, including the paperwork or the discharge documents, the prescriptions, and other things that he has to note for the discharge documentations. So on the nurse's side, the only thing we need to do is to fill out the discharge assessment form, which normally takes around 5 minutes. So in this document, it includes the status of your patients, how he was discharged from your hospital. So you have to document it properly. So here included about the physical assessment, including some of the wounds. If ever the patient has a wound or pressure ulcer, definitely you have to take a picture so that you have a baseline of what the wound looks like before he leaves your area. And you have to upload it in your system as well. The nursing health teaching is part of your role. So here, it's really simple because a bunch of protocol or health teachings are already in the systems. So for us, I just need to select some of them. For example, my patient is discharged with a diabetic foot ulcer. So I just have to click like a DM or diabetic protocols. Then all of the things that he has to note about the diabetes, it will show. And whenever I print the discharge papers, it will include. So there's a bunch of modules about it that he can read for the discharge. So I don't really have to tell them one by one and base it on my experience. They will actually give you a form or a pamphlet about it. So if the patient has other conditions like hypertension, you can click on that, or the patient has problems with the kidney, so you also can click on that. So whenever you print for their final documents, those things will be included for the health teaching. Most of the doctors will put in the details for the following appointment. Sometimes they will schedule it by themselves and put in the appropriate date and time for the patient to come back. And sometimes they will just put in the details for the patient to call in order for them to book an appointment. Because most of the patients do have some work, so they have to schedule an appointment wherein it fits their schedule. Then, if ever your patient was referred to a specialist, normally the doctor will send a document going to that specialist clinic with the referral form. Then once the specialist clinic receive those referral documents, they will try to find a schedule. And once they find a schedule, they will call the patient and then tell them about the appointment date. If the patient is willing to get the appointment, then they will finalize those appointment dates and book them as well. If not, they will then reschedule. So, in other words, they will be the one coordinating by themselves. Then before the patient leaves, we need to discontinue or remove some of the things. For example, like the IV cannulas or the Foley catheters, or change the dressings, and a lot more things. So we have to make sure that before they leave, those things will be settled. Then for the medications and supplies, then if there's unused medications, normally we'll just return everything in the Pixis, which will take like 2 to 3 minutes. That's easy. It's normally found in our station, so you don't have to go down in the second floor or different department just to return those items, like back in the Philippines. So we don't do that here. Then returning some of the supplies. Normally here, we just get whatever we have in our central supply room, and it's located in our nursing station. So whatever we need, we just get it and return it. We don't really have a box wherein we put everything like the CSR or the medications. We have a big main CSR wherein we don't really have to charge everything that's in it. So technically, there's nothing to return. Then the next thing is help the patient pack up, give him or her some plastics in order for him to put her personal things. Then once everything is cleared out, he or she's ready to go, then you will explain everything. Let them sign the papers stating that they have received these documents and health teaching was done for these particular things. And appointment was given and the prescriptions. So they just have to sign those things. After they sign, then they can leave the hospital. So it's that easy. If you're wondering about the bill, here in the US, the bill is normally sent to the patient at their mailing address. And usually it takes around 2 weeks to a month before they can receive the total breakdown or all the things that were being charged during her hospital stay. So it's not like back in the Philippines where you're really pressured in order for the patient to be discharged before 12 noon. Here, you just let them go. It's the same thing in Singapore, wherein both of them are first world countries. So most of them do have an national ID. So that's one of the advantage of having a national ID. So it's easier for these hospitals to charge those patients even if they already left the hospital. Then, if your patient is for discharge to a nursing home, normally, what we do is we call the command center and tell them that we have a patient for discharge, and they will try to book an ambulance for us. For the ambulance schedule, they won't give you a specific time for the patient to be discharged from your facility. Normally, it comes like a first come, first served basis, and sometimes they do have to respond to emergency cases while en route to your hospital. So if ever something emergency happens, they have to respond to those things first before they go to your patient. So based on experience, it's really normal for patients who has a discharge order in the morning and will be discharged late in the evening or like middle of the night or like 3 a.m. For them to be discharged to a nursing home. Because like I said, ambulances has to respond to emergencies. So usually they are really fully booked on those kind of things. So being a stable patient for discharge is not really their priority. You really don't have any control on it. So you just have to wait for the ambulance. Then once the ambulance arrives, then you can discharge. Then once the ambulance arrives in your facility, you just have to give them a report about breakdown of the patient, what's happening on her, like a status, if he needs an oxygen, or if he needs a wheelchair, or other things that he needs during the route going to a nursing home. And normally, you will print all the documents that you have to give to the nursing home. So this includes like the medications, the nursing laboratory or the laboratory results, the diagnostics procedures, and everything. So in order for them to get an update on what really happened during your confinement or the patient's confinement in your particular facility. Then another form of discharge. If the patient wants to leave or like go against medical advice, you don't really have to chase them and tell them to stay. If they don't want to, it's their right. So that's it. So just say bye-bye. Unlike back home wherein if a patient tries to AMA, we really try to convince them to stay in order for them to get the proper care. But here, if they insist, even though you already explained everything, so you just say, do whatever. You just have to inform the doctor first and tell them the patient wants to go against medical advice. And normally, if the patient says that he wants to go and the doctor has nothing to do or can't do anything about it, so he'll just say, okay, let him go against medical advice. So you don't have to give the patient anything like medication or prescription. We don't care about the bill. We don't care about anything. So just remove all the IVs, anything is attached to him, the cardiac monitor, then letting him sign a paperwork or the AMA paper, then he or she can leave. So that's it. So it's that easy. So hopefully you learned something from this video. On our next video, let's tackle about medications, on how we administer and things you need to know, things you need to avoid in order for you to prevent any problems when it comes to taking care of your patients when giving your medications. So make sure to click the subscribe button, like button, and please share to your friends. Again, I'm Nurse Juan de la Cruz, your OFW nurse. Thank you for watching. God bless. Bye-bye. See you next time.